Hi, my name is David Billings. I'm one of the teaching practice preceptors here working in Southampton. First of all, I'll tell you, I do have a fairly comprehensive medical practice. I have my family practice setting where technically work probably about half time. I have about 1,000 to 1,100 patients, which are a good mix of everything from babies to well baby checks to geriatric care, prenatals, children, a good mix of pretty much everything. The only thing we don't do any intrapartum obstetrics, but pretty much everything else very comprehensive in terms of family practice. We do have a small community hospital here as well too, so I do work anywhere between 4 and 6 emergency department shifts per month, and that would be a mix of day shifts and night shifts. And that, like I said, it's a small community hospital. It serves about 17,000 visits per year, so fairly busy compared to a lot of other rural ERs. And it's sort of, you're on your own. It's going to be Owen Sound is our closest referral center, so you do get a little mix of everything. You will get orthopedics and a lot of internal medicine, cardiology. So a lot of the residents, when they come up, they quite liked it because there's a lot of procedural things that we get to do. It's a 16 inpatient unit as well too, so we do look after our own inpatients that get admitted to us. And that can be anything from a variety of chronic care, people awaiting placement, things like pneumonia, COPD, post-op hip, convalescence. We generally don't look after a lot of pediatrics or psychiatry patients though. That again would all get referred to Owen Sound. So between my family practice, emergency department, inpatient work, the other main thing that I do is there is a walk-in clinic at the Bruce Power nuclear plant, which is about half hour outside of town, largest nuclear plant in the world. And we do run a 5-day-a-week walk-in clinic out there. I'm one of the 3 physicians that does that. So 1 or 2 days a week I'll go out there, where again it's a mix of occupational health type of medicine, but a lot of it is still family practice style medicine, people who are transient workers whose family doctors are somewhere else. And realistically, every week is a bit different depending on the schedule. It's a good mix of a lot of different things. And for the residents coming in, if they have other interests that they like, such as anesthesia, we've had some that are interested in surgical assisting. We can make arrangements for some of that as well too. The community itself, Southampton, it's about 2.5 hours probably north of Toronto. It's right on the shores of Lake Huron. Absolutely beautiful. Any time of year, there's something here for the residents to do. Summertime, this is a very big beach community. Beautiful powder sandy beaches, a lot of water activities, paddle boarding, a lot of beautiful hiking trails around, bike trails. Any sport you can think of you can do here. And again, I've had a lot of residents that like playing hockey, so a lot of pickup hockey around, so people bring their equipment and easily have stuff that they can do. The clinic that I work out of is literally across the street from the condo that the residents stay in. A beautiful condo, 3-bedroom. Again, you walk out, you can see the lake. It's a 3-minute walk away. So very close to where you'd be staying. The hospital might be a 10-minute walk. And when we go to Bruce Power, I usually drive the resident anyway, just because we have to check in through security at the same time. So realistically, no, you don't need transportation. You just need to get here from Toronto. The population here is probably about 17,000, and that's divided between 2 communities, Southampton and Port Elgin. Port Elgin is mainly a sleeper town for Bruce Power, a lot of young families. All the amenities, you know, restaurants, everything like that that you could want would be there. The population triples in summertime, big tourist destination, which therefore means our ER tends to be a little bit busier in summertime as well. So we prepare for that, we plan for that. Everybody that's come up has enjoyed it. It's a very relaxed atmosphere. So, you know, you come up here, you let us know how you want to tailor your rotation to get the maximum out of it, because you're not that far away before you're independent on your own. So maximize your learning, your training, and you know, we've been very accommodating for that. The hospital, again, as I told you, it's fairly busy ER. It's the second busiest ER in Grey Bruce. We do have a physician assistant that works through there as well too. There's 2 nurses on at all times. And we have backup physicians and, as I said, GP anesthesia as well too. So even though I said all our specialties are in Owen Sound, we're very well backed up and nobody's really felt left alone. And from a resident perspective, again, we try and maximize your procedural skills and opportunities. You know, pick the charts that are most interesting to you. Get the most out of your experience. And we have an RN on site as well. And so she helps with a lot of the well baby checks, the physical exams, the pap tests, vaccinations, all those things she helps with. So it just helps to keep the flow moving for both myself and the residents. There's a fair bit of, in the peak season, so not summer season, we do a lot of skin consults and things like that. So depending if somebody's interested in derm, because I know that's an area that's fairly neglected in family medicine training, you can get a fair bit of skin exposure, you know, see what needs treatment, what doesn't need treatment, and a lot of the residents have found that beneficial. So a good mix of everything, and as before, the residents can help tailor that to what works for them. So hopefully we'll see you guys here soon.